Our laboratory session today is about the functional localization of the cerebral hemisphere. First of all, Brodmann described the system of numbering and nomenclature of the cortical layers, and he said that the layer that possesses 6 layers is called homotypical, while the heterotypical either granular or agranular layers. We start to describe the cerebral hemisphere into, or functional aspect of the cerebral hemisphere into different lobes. And we start with the frontal lobe. The precentral area of the frontal lobe can be divided into 2 parts, posterior part and the anterior part. It is an area 4 of the cerebral hemisphere. The posterior region representing the primary motor area. And the anterior region called the premotor area. Or secondary motor area, or Brodmann 6, 8, 44, 45. As you see, it is extended to the Broca's area. Stimulation of the primary motor area produce isolated movement on the opposite side of the body. The movement area or the representation of the body in the precentral gyrus, as you see, it's an inverted position. First, with area of the tongue, then the face, neck, thumb, hand, and on the medial side, we can see the trunk, area of the trunk, and leg and the foot, lung and trunk and the leg and the foot on the paracentral lobule of the cerebral hemisphere. Movement of the hip, knee and the ankle is located into the highest part of the precentral gyrus, so that a lesion or an accident in this region can produce paralysis to the hip or ankle or perineum. As you see, the paracentral lobule in this region is responsible for the vesical and anal sphincter control. The function of the primary motor area is produce movement when stimulated, produce and movement into the contralateral side of the body, while the function of the premotor area is to program and even skill the movement. Paralysis or lesion into the motor cortex may result into paralysis of the contralateral side in the primary motor area, while in the premotor area, the paralysis or the lesion result in apraxia, condition called apraxia. What is the apraxia? The apraxia can be defined as an impairment of performing of limb movement in the absence of the paralysis. So that we're shifting now to another part or the region which is anterior to the premotor area, which is located or extending from the precentral gyrus to the middle frontal gyrus. This area is called frontal eye field. Frontal eye field. The frontal eye field is responsible for control, voluntary conjugate movement of the eye. Here we can see in this specimen the area of the frontal eye field anterior to the precentral sulcus and occupied mainly the middle frontal gyrus. And here in red color area is primary motor area. Primary motor area. Stimulation of the frontal eye field here cause deviation of the eye to the opposite side of the body, while damage to this region or destruction to this region may result in a conjugate deviation of the eye toward the side of the lesion. Now on the inferior frontal gyrus, we can see the important region because it's containing the speech area, and this speech area is called motor speech area. Here we can see in the red color area which occupying the frontal inferior frontal gyrus, triangular and the opercular part of the inferior frontal gyrus. The dominant hemisphere in the Broca's area is the left hemisphere, and this region numbering 44 and 45. Anterior to this region, there is a prefrontal cortex. Prefrontal cortex. Here you can see this is the prefrontal cortex, which consisting of the parts of the superior frontal gyrus, middle frontal gyrus, and the inferior frontal gyrus, even containing part of the orbital gyri. And on the medial aspect, it's containing the medial frontal gyrus and anterior part of the cingulate gyrus. The function of the prefrontal cortex is concerning with the individual personality and behavior, judgment, and the foresight. Now we are shifting to the parietal lobe, which is posterior to the central sulcus and superior to the lateral fissure. We can see this is a primary synesthetic area or primary sensory area, which occupying the post-central gyrus. Also we have post-central sulcus anterior or posterior to it. Most of sensation reach the cortex into the contralateral side. There is an exceptional part in the oral region, which is transmitting the sensation to the same side, and also in case of the pharynx, larynx, and perineum go to both sides. The secondary synesthetic area on the dorsal wall of the lateral sulcus. This is the lateral sulcus. And on the dorsal wall of the lateral sulcus, and may extend down to the insula. The contralateral representation is a predominance here. The superior parietal lobule here and the pericuneus is regarded as a synesthetic association cortex. Lesion cause agnosia. Lesion of the angular gyrus and the cause condition called alexia, which is unable to read, while the aggravation paragraph here is disability affecting the writing. What is disease resulting or condition that result from damage to the association cortex? This condition called agnosia. Agnosia, there is a loss of the ability to recognize object, person, sound, shape, or smell. Although there is no specific sense defect or there is a significant memory loss, the most important thing is gastroagnosis, in which the patient find difficult to recognize objects by touch, result by damage into somatosensory cortex. What about the occipital lobe? The occipital lobe here you can see, is the visual area 17. The visual area, also called the striated area, because it containing the striae of the genari, which is located along the calcarine sulcus. As I said from the previous laboratory session, the calcarine sulcus starting below the splenium of the corpus callosum toward the occipital pole of the cerebral hemisphere. The secondary visual area is area 18 and 19, which recognize past visual experience, while the occipital eye field, the function of the occipital eye field is movement of the eye when following an object. Regarding the temporal lobe of the cerebral hemisphere, this is a primary auditory area in green color. Primary auditory area. And also called acoustic area. You can see that if we open the floor of the lateral fissure, you can see the ridge-like structures called Hassel's convolution, which is regarded as a primary auditory area. While posterior to the primary auditory area, on the floor of the lateral fissure, there is a condition or secondary auditory area, or what we call it planum temporale. The function is, of the secondary auditory area, is to necessary for the interpretation of the sound. Another important area which is located into the superior temporal gyrus here, and even extend to the parietal lobe, and this called the sensory speech area or vernix area. Lesion in the vernix area result into condition called aphasia, which is called receptive aphasia. So that damage into the sensory speech area result into receptive aphasia, while damage into the Broca's area result into the motor speech area or expressive aphasia. If both region, I mean the primary motor area, the motor area and sensory area damage, resulting in a condition called a global aphasia. What about the taste area or the gustatory area? Gustatory area. This is the lateral fissure, and this is the central sulcus and precentral gyrus, postcentral gyrus. Precentral gyrus, postcentral gyrus. This is the motor area, and this is the sensory area. Primary motor, primary sensory area. And the taste area or gustatory area located into the inferior part of the parietal lobe. Inferior part of the parietal lobe into the superior wall of the lateral sulcus. This is the lateral sulcus. Lateral sulcus. And into the superior part of the lateral sulcus, we can face with the taste or gustatory area. While the vestibular area is situated near the part of the postcentral gyrus. This is the postcentral gyrus. Is located into the area of the postcentral gyrus concerning with the face region. Now, what about the cerebral dominance or lateralization of the cerebral cortical function? The left hemisphere is dealing with language, mathematics, science, and logic parts, while the right hemisphere is concerning with singing or playing musical instrument, reading the facial expression and intuition. So that the dominant hemisphere into the language area is the left cerebral hemisphere.